راح نحكي الآن عن الهيد لايس والبودي سكيبز. بالنسبة لللايس طبعا microorganism usually lives on the occipital area of the scalp. It's about 3 to 4 millimeter in diameter. Why it lives there? And the environment there is very suitable for the eggs to hatch. طبعا eggs is called nets. زي ما شايفين عندي this is the adult lice. في عندي الجي اي تراكت الموجود فيها وفي blood, so it sucks blood from the scalp. عشان هيك البيشنت يمكن يجيني ايش؟ pimples that are very itchy على scalp. Those pimples can be scratched by the patient and we might have secondary impetigo. So any patient with recurrent head-ending impetigo خاصة pediatric age group, rule out head lice. How should we diagnose patients? Usually patient يكون عنده itching بالسكالب, بيكون في family history of similar condition أو his classmates might have similar condition. On further looking, we might be able to see the mite itself. إذا شفنا المite معناته this is definitely the patient is infested. Okay. Usually the average number of mites على scalp is 10. Okay. أو we can see إيش by dermatoscope. We might put dermatoscope على الهير. شايفين الصورة اليمين هاي فيها إيش النتس أو الإيجز they are adherent to the hair shaft. هلا استعملنا dermatoscope which magnifies by 10 times أو أخذنا هير في إيش نتس حطيناها تحت المجهر أو تحت الميكروسكوب. we might see إيش النتس like this. الصورة الموجودة تحت المايت. أوكي. فهاي النت وهاي الإمبريو موجود جوا. it's a black أوكي body موجود جوا. فالكاب الموجود على السيرفيس بعده مسكر. فالإيج is still إيش alive. it hasn't hatched. هذا كان عندي إيش النتس موجودين على السكالب but it's open وما في عندي إمبريو جوا. it's empty. This is not a sign of active infection or infestation and there's no need for treatment. But we need to bring the patient to the clinic within 2 to 3 days for re-examination. We might be able to see full nets. Okay. And the next step is to treat patients. We need to examine the scalp of the patient أول شيء. We might be able to see impetigo. يمكن نشوف في عندي secondary eczematous changes, secondary maceration of the skin. The skin أو الهير become mated وسميلي. يمكن البيشنت يصير عنده lymph nodes. اوكي. فاني ليجنز بالهيد والنيك اريا rule out head lice. rule out head lice. حتى لو متاكد انه اكزيما rule out head lice. اوكي. فالنكست ستيب حاليا بالتريتمنت حكينا في عندي multiple options of treatment. The first line of treatment is نعطي ايش dimethicone. dimethicone بيعمل ايش؟ It surrounds the هي عباره عن gelatinous material surrounds the mite وبيعمل suffocation. ف it should be applied on the scalp to be left on the scalp for about 8 hours and within 1 week the eggs will hatch. So we need to reapply it again after 1 week. So 2 applications 7 days apart. Okay. هلا with combing لازم نعمل combing once every 2 to 3 days to remove ايش the eggs. We need to examine the whole family members, examine the mates of the patient. Okay. Second line of treatment is dimethicone مش متوفر. I can use permethrin. 5% lotion can be applied on the scalp for 24 hours or 12 hours وبعدين it can be reapplied again within 7 days. If it was not available, then benzyl peroxide can be used once every day for 3 days. Then it should be stopped for 7 days, and then we can reapply this once a day for 3 days. If you have secondary bacterial infection like impetigo or something like this, we need to give the patient appropriate oral antibiotics. هاي بالنسبة للهيد لايس. اوكي. في عندنا other types زي body lice والمايكرو اورجانيزم هناك بتعيش وين؟ على الكلوذز. The second picture, this is the Sarcoptes scabiei var homins. It's 10 times much less in size than the head lice mite. So this is 0.3 to 0.4 millimeter in diameter. It has 4 pairs of legs. Okay. Usually an adult infected patient might have an average of 10 mites. البرايمري ريجن في السكن اللي تعملها هاي المايت بسموها برو هي عباره عن linear او curvy linear papule where this might dig deep inside the stratum corneum to ايش put the eggs. ف هلا الايج once it hatches after let's say 7 days the patient might start to ايش feel itching. The itching ناتج عن scabies is due to type 4 hypersensitivity reaction to the mites and their byproducts. So the mite and their byproducts. So it's type 4 hypersensitivity reaction, which means sometimes the patient might need up to 8 weeks to develop symptoms. The incubation period for this condition is from 2 to 8 weeks. This is very important for the management. So if a single family member has scabies and he's very itchy, while others don't have, it doesn't mean that the patient needs to be treated alone. So we need to treat the whole family members regardless of their symptoms, because the infestation or infection might take up to 8 weeks to appear on the skin. So always treat the whole family members. The picture below, or picture down, and those are the eggs for the mite. And how should we examine the patient? We need to examine the whole body. Typical sites that need to be examined is the web spaces of the fingers on the hands, the wrist, the flexural aspect of the arms, around the nipples, chest area, abdomen, and the groin, in addition to the medial aspect of the thighs. In the groin area, in the male patient, we might see rubbery nodule at genital area at a glance, which is called rubbery nodule or rubbery papule, which is very pathognomonic for scabies. Our next step is either to examine the patient with the dermatoscope, looking for burrows. At the end of the burrow, you might see black triangle, which is the mite. Or we might do is put oil on the skin, mineral oil, and we then do scraping by the blunt edge of the blade, and we put them on a slide to see the mite if we are lucky under the microscope. Most of the time, we treat the patient empirically. So look on slide number 3, you might see linear papules. So those are the burrows. The burrows are typically seen in the pediatric age group or in infants because they can't scratch the skin, so the burrows would be intact. While in adults, we might see changes just like eczema or psoriasis even sometimes. So always examine the patient, especially with the new onset eczema, eczematous changes, and itching. Try to examine the whole body, mainly the genital area. Treatment for this condition is, first of all, we need to treat the whole family members. We can give oral antihistamines. First line of treatment is permethrin, 5% lotion or cream to be applied on the body, from neck down there. And in pediatric age group, it can be applied on the face because they don't have sebum. As we've said, the sebum sometimes can be protective to the adults, not to get scabies. So the medication should be applied on the skin surface for 12 hours and then be washed, and in 7 days need to be applied again. Usually ask the patient to clean or wash the clothes and linens. First of all, he might be able to put them in a black bag for 3 to 4 days, and then, I mean a plastic bag, and then they can be washed easily. Sometimes if the method is not available, we can use benzyl benzoate once a day for 3 days, then stop for 7 days, and should be applied again once a day for 3 days. For the if there's no response or if there's resistance, there are some oral medications that can be used to treat the scabies and even the head lice, which is oral ivermectin, single dose. This is all what we need to know regarding the scabies. Thank you.